Hilltop.
Awesome, thank you. And Carol.
Hi, I am Carol Flispart. I'm community education rep for CareSource, which is one of the Medicaid companies in the state, providing benefits for a Healthy Indiana plan for adults and Hoosier Healthwise. And I am part of the Washington County Health Action Team. So I wanted to find out what all is going on with all the data in that.
All right, great. Chloe.
Hi, my name is Chloe Hurst. I am a student at Indiana State University in the dietetics program, and I'm currently an intern with Connections in Health.
Thanks, Chloe. Alia.
Hi, I'm Alia Amin, and I lead the Cardiovascular Disease and Diabetes Coalition of Indiana under Connections in Health.
Thank you. Desiree.
Hi there, my camera's a little wonky. I'm in transition here. My name is Desiree Prater, and I am the new prevention coordinator with the Washington County Family YMCA.
Thanks. And Gina.
Hi, good afternoon. I'm Gina Claxton. I'm the program manager with Community Health Partnerships at the Indiana Clinical and Translational Sciences Institute, which is the organization that Connections in Health is a part of. So I get to work with this team every day.
Thank you. Donna.
So I saw another Donna on here, but I'll go first because maybe I was the one. So this is Donna Vandergraff. I'm an extension specialist with Purdue Extension. And I am also the Purdue liaison to the group that Gina just mentioned, right? So Indiana CTSI, Community Health Partnerships, Connections in Health. And so I'm pleased to be part of this group today from both the extension lens and the Connections in Health lens.
Awesome, thanks. How about the other Donna?
My name is Donna Hurst. I am the Children's Department Director at the Salem Public Library in Salem, Indiana.
All right, welcome. Milan.
Hi, I'm Milan Gaston, and I'm a master's student at the IU School of Public Health in Bloomington, and I'm also a project associate with Connections in Health.
Awesome. Chelsea.
My name is Chelsea Miller, and I am the Associate Executive Director at the Washington County Family YMCA in Salem.
I'm so sorry, Miss Butler. I'm probably going to butcher your name, but I bet it's beautiful. Is it Tierra? Oh, there she is. Sorry, my camera and mic hasn't been working. Tierra. Thank you for that. So I could pronounce it, Butler. I can't read the rest of it. I am an undergraduate student at IU majoring in epidemiology and minoring in psychology. Welcome. Liz.
Hello, I'm Liz Stout with Anthem Medicaid. I am the program administrator for part of the Southeast and the central part of the state. I've been working with Connections in Health team.
Thanks, Liz. Cassandra.
Hi, I'm Cassandra Skyer. I'm the dietitian at Ascension St. Vincent Salem Hospital.
All right, welcome. And Caitlin. Actually, Caitlin, your name is on here twice, but I know you're in you're in the room in person. So I'm not sure which Caitlin wants to go first. It's not Caitlin.
Okay.
I think maybe when I sent out the calendar invite to some of the coalition members, it somehow put my name in there. So there's Jennifer, and then I'm not sure who the person is without the camera, but Jennifer, if you want to introduce yourself, that'd be great.
That is weird. My name is Jennifer Neff Whitlow. I'm from the Nurse Daily Partnership Program. I am raised and born and everything in Washington County. I have always worked in Washington County all my life. So yeah, I'm interested to see what is going on.
Thanks, Jennifer. Kirsten.
Hello. Apparently I took your name, Caitlin, so I'm sorry about that. But I am Kirsten Vincent. I am the Community Relations Specialist for Unite Healthcare Community Plan, which is one of the options for Hoosier Care Connect that is specifically for individuals that are aged over 65, children in foster care, blind, disabled, and individuals that receive SSI.
Welcome. And Jill.
Hi there, I'm Jill Tooley Walters, and I am the West Region Supervisor for the Purdue Extension Nutrition Education Program. And I work with Caitlin Kudemeyer, and she sent out the information and invited me to hear just an overview of what all's going on here in Washington County.
Great. Welcome, Jill. Good to hear you.
Thank you.
Antonia.
Hello, everyone. I'm Antonia Sawyer, and I lead the Hoosier Health and Wellness Alliance, which is a statewide health coalition focused on reducing obesity across the state of Indiana. And I'm part of the lovely Connections and Health team. Great to see you all, and thank you for having me.
Thank you. And Selena.
I'm Selena. I'm with Hoosier Uplands. I'm with the Bright Futures for Families program and also the Washington County Tobacco Prevention Coalition.
Welcome. And I see Courtney has joined us. I'm not sure if you want to introduce yourself on this part or in the room.
I will, yeah.
Oh, gracious. Try again. Okay, just kidding. I think we'll go around the room then if Caitlin and Sonia want to.
Hi, I'm Caitlin Kudemeyer. I'm a community wellness coordinator for Purdue Extension's Nutrition Education Program. And I serve here in Washington County. And I have been a part of the Connections and Health team, and then also co-facilitate the Community Health Action team.
Hi, sorry for that dramatic introduction. I'm Courtney Stewart. I work with Connections and Health with Karen and Gina and Aaron and Alia and Antonia. I lead the Indiana Joint Asthma Coalition, and I am actually here in Washington County today. So thanks for being here, everyone.
And I'm Sonia Mitchell. I'm the Health and Human Sciences Educator with Purdue Extension here in Washington County, and also part of the County Engagement Team. Glad to see everybody here today.
I'm Tina Mitchell. I am the Community Outreach Coordinator for LifeSpring Health System in the Eastern Division.
That is everybody that is here in person with us today, Karen.
Okay, thank you. All right, so I'm going to share my screen. Hopefully you will be able to see slides. Are you able to see the slideshow? Aaron gave me the thumbs up, so I think it looks the way it's supposed to. Okay, so once again, welcome. We are glad that you are here and interested in the data and interested in helping to improve or finding ways and strategies to improve health in Washington County. So we're going to go through some slides and give you a ton of information. We have lots of different people in the room and on the screen who are going to share. I'm going to run the slides from where I'm at, so feel free, those of you who are speaking, to just say next slide, or you can go on, or however you want to tell me to keep advancing. I want to start with an overview and tell you who we are and where we're coming from and why we're doing what we're doing. And then we'll get into some data and sharing back what we heard from people that we talked with in Washington County. Then we're going to have community partners share about what they're doing to address health in the community. We've got another opportunity for you in February to get involved with some planning for spending some community funding. So you'll hear more about that, and we'll have opportunity for questions after that. If you have questions along the way that you want to drop in the chat box, feel free to do that. I know that if I don't jot them down when I'm thinking of them, I will forget. So feel free to drop them in the chat box if you have questions along the way. This is being recorded, and we will share this recording after the fact, and we will share the majority of the slides. I think some of the slides we're not able to share, but most of them we are. So you'll get an email about that in February, so you can review this, check out the slides, click on the links, share it with other people if you would like to. So, and I'll also note that sometimes you'll find a link on the slide. So we'll talk kind of briefly about some things. And if you would like to know more when you get the slides, feel free to click on those links and you can get more information. And as always, you can reach out to any of us. And Sonia and Caitlin know how to reach us if you don't have our direct emails. Feel free to reach out to us anytime with questions. Excuse me. So real quickly, I would venture to say that a lot of people in Indiana aren't aware of the fabulous resource of Indiana Clinical and Translational Sciences Institute. Excuse me, I know I wasn't before I joined the team. And it is a fabulous place where IU, Purdue, and Notre Dame all work together to help with research, and also to help bring that research and translate it from the research lingo to community-friendly lingo so that people can use it, that information in the communities. So you can see in the image, there are lots of different organizations that we partner with. There are bidirectional arrows because we work together on lots and lots of things. So sometimes they come to us with something they want to work on, and sometimes we go to them and say, hey, we're thinking about this. Would you like to work together on this? So lots and lots of information there. We are housed at IUPUI downtown Indy in the IU School of Medicine. So it just keeps, there's lots of levels to this. So I'm going to keep going closer to Connections in Health from the Indiana Clinical and Translational Sciences Institute. So there is a community engagement arm within Indiana. We call it Indiana CTSI. So within Indiana CTSI, there's a community engagement arm that Gina mentioned. It's called Community Health Partnerships, and Connections in Health is a part of Community Health Partnerships and that engagement with the community, taking that research information out into the community. So this model on the screen shows about what Connections in Health is. Everything within that gold band is part of Connections in Health. There are 3 statewide health coalitions. All 3 of those leaders of those coalitions are present today, and I have introduced themselves. They focus on areas of nutrition, physical activity, cardiovascular disease, diabetes, stroke, and asthma. There's a 4th piece there that says cancer control, prevention, and equity. That is not necessarily its own coalition, but a person who is going to be a liaison between the IU Simon Comprehensive Cancer Center and all things Connections in Health. So they'll be able to serve as a liaison and go back and forth between the 2 teams. These 3 statewide coalitions have been in existence for several years, well before Connections in Health. And we all joined together technically in late 2018, but in reality, things started happening in 2019. So that shift took place and the coalitions are all now working together under the same umbrella. Those are all funded through Indiana Department of Health. The cancer control, prevention, and equity piece is funded through the Cancer Center. And then Indiana CTSI is where we live, and they fund everything else. So lots of other things that are happening and that we have access to. So our job is to have a positive impact of health on health outcomes across the state of Indiana. There's 92 counties in Indiana. It's not like we can just get to know everybody really simply. So when they put the project proposal together, they decided we needed to focus on counties, like 1 county at a time, and really get to know people, get to know their community, find out what they want to address health-wise, and work with them and provide some data, provide some support, resources, evidence-based strategies and interventions so that counties are able to get to know us, get involved in our state coalitions, and we can kind of work together across the state. Instead of trying to dig very shallow across the state, we're going, with all the counties, we're kind of talking to 1 county at a time. So briefly, here's how county selection happened. Aaron actually is on the call, and Aaron worked on putting a ton of data together related to social determinants of health, county health rankings, life expectancy, lots of data related to the coalitions and their focus areas, ranked the 92 counties. And then we shared with the partners in the puzzle pieces on the screen and said, where do you think we should go? Where do you think there's the most opportunity? There are people who are willing to partner. Maybe there are already groups and organizations that are working in some of these arenas. And also, where should we not go? Where do you think there are groups that are focused on something else? So maybe we might be a burden if we try to work with them right now. And after that feedback, we came up with these 10 counties that are on the map. I'm sure that some of the words are super tiny, so I'll tell you what they are. We started in 2020 working with Grant County and Vermilion County, and they're blue. Right beside Grant County is Blackford County. We worked there mostly in 2021. We're still working in these communities. We just have finished with the engagement piece. Washington County is green. That means we've been doing the engagement and we're sharing back information with you now. So that county, your county, will turn blue soon. Lake County, we're going to have to turn that one green here soon because we have started establishing relationships there. Madison County, we're hoping to establish relationships later this spring and early summer. And then sometime in 2023 and 2024, we will hopefully establish some relationships in Stark County, Marion County, Clay County, and Jennings County. So those were the first 10 counties with data and input from our partners that we have selected to engage with. And Sonia and Caitlin wholeheartedly welcomed us with open arms and in fact invited us and said, come work with us. So we are delighted to be working with you. I know we're not all there in person with you right now, which is unfortunate, but hopefully we'll still get to do that at some point. So I just want to show you real quick. This was as of July 2021. This is where we had members in the statewide coalitions that we have. We're currently working on updating this and asking our members to share their information so we can have an updated map. I think it's important for you to see this because that means we can connect you with people from all over the state. We have people that are experts and are passionate about health all over Indiana. There are just a few counties on there that are gray, which means we did not have representation in our coalitions from those counties in July. Hopefully some of those are now blue. The darker blue counties indicate we have 6 or more coalition members in those communities. So just wanted you to know the vast resources and connections that our coalitions have across the state, and that is something that we can tap into with this group and the challenges that you would like to address to see if others have addressed something similarly. These are the sectors that our coalition members represent. So you can see we largely are represented by community members, healthcare systems, community-based organizations, education systems. We really want to connect more with military and businesses. So we're hopeful we'll be able to increase some of those partnerships soon. And now I think I'm going to turn it over to Aaron.
Awesome. Thank you, Karen. So Karen mentioned we've been working in Washington County, and we've probably talked with a lot of you throughout this process to talk about what successes, what challenges, what you see in your community, and how best we can bring in resources to help, facilitate some of those programs or anything that's going on within the community. And so some of the ways that we heard from you all was via our interest survey, which 170 people completed, which to my knowledge is probably the most in any community we've had. So I know that Sonia and Caitlin spread the word wide, so kudos to them. So that's a lot of information. And then we had 48 listening sessions, which were essentially one-on-one interviews or a couple folks joining interview sessions, again, to talk about some of those successes and challenges. So 48 people, 48 interviews, that's a lot of information, a lot of qualitative data to look through. I'm a big fan of the data, as Karen's mentioned, so I like to put a little bit of context to some of the things that these people were talking about. Karen, if you want to go to the next slide. And that is kind of where Washington stands now. You know, there's what folks are working on, and what are these outcomes as they are now, and what can we strive to improve. So a couple areas, and I specifically chose these things because they correlate to those 3 chronic disease coalitions that Karen mentioned earlier. So we talk about cardiovascular disease, diabetes, and stroke within CADI. So you can see within ischemic heart disease, Washington is slightly above average, or excuse me, I should say slightly above Indiana averages in both male and females. Diabetes prevalence is about the same. It's only 1% more in Washington. Stroke is higher, particularly among women in Washington County. Asthma prevalence, 10% is what you see in most counties across the state. It is slightly higher in Washington. Lung cancer for both male and female is higher. Breast cancer is actually slightly lower than the Indiana average. Physical inactivity, so the amount of people who are physically inactive, the prevalence is 4% higher in Washington than in Indiana as a whole. Food insecurity is slightly below the Indiana average. Obesity slightly above, and then access to exercise. So those who are able to access parks, access walkways, pathways for running, biking, what have you, accessing a gym is significantly lower than the Indiana average. So this just, and again, this is just to put in some context. It's not necessarily a bad thing, but it's something we can say, hey, you know, that's an area where we can work on. But in the next slides, I really want to highlight a lot of the successes that folks pointed out when we had our conversations with them. And so again, I organized these by the coalition focus. So when it comes to CADI, the Cardiovascular Diabetes Coalition, what a lot of people said was there's success with the Purdue Extension Dining with Diabetes program. They've seen improvements in A1C levels in clients. There's plenty of educational opportunities for nutrition and diabetic care. Increased screenings for hypertension throughout the community, as well as great rehab facilities for heart issues. And then the next one is cancer and tobacco. The Tobacco Coalition is very active. The coalitions, and there's a lot of partnerships in the community. Lots of interventions and education on tobacco marketing. Screenings for lung cancer within the community, as well as the tobacco quit line was emphasized again and again and again, with Washington County being utilized a lot. The next one is going to be nutrition and food security. Walmart was emphasized as a large contributor to the local food banks, as well as Purdue Extension's nutrition and wellness classes. The Community Health Action Team has a focus on physical activity and nutrition. There's a wellness fair in partnership with the Center for Rural Engagement. Utilization of active food banks. We heard again and again that the food banks are working tirelessly to make sure everyone is fed within the community, as well as the First Christian Church's community meals twice a month. Physical activity, walking programs, biking trail. The high school has a wellness program that promotes healthy living. Again, the YMCA was noted so many times for many reasons. And then again, the new walking trails. And then lastly, some successes that I also wanted to note that weren't necessarily a part of one of those coalitions, but were important to highlight. Depression screenings. Life Springs has a federally qualified health center. Light in local parks. The Students Against Destructive Decisions programs in school is productive. And the Queer Straight Alliance are just another couple of things that were additionally successful. So there's a lot of great that's going on in the community, and it's kind of important for us to recognize where there are folks working right now so that we can help to bolster some of those initiatives. That's it for me, and I believe I'm going to be passing it off to Crystal to talk a little bit more in depth.
Thank you, Erin. So I just wanted to cover some information on the 5 leading causes of death
As you can see here, there are Washington County, Indiana, and United States, the comparison groups, and then also looking at it from a trend from what were the numbers in 2016, 2017 to what they are in 2018, 2019. So the numbers that you're actually seeing here are the number of deaths per 100,000 people. So I know Washington County is really small, so if you were to just look at the numbers, it would be very hard to compare it to Indiana or the United States as a whole. So this is just an easy way to compare numbers across different areas. And then the left has the 5 leading causes of death. So diseases of the heart is like hypertension, heart attack, and there's just different things. The numbers below are the actual ICD-10 codes that are used to identify what the cause of death is. So if you look at Washington County in general, the numbers are typically higher in all 5 areas across the board in comparison to Indiana or the United States. And then if you look at change over time, again, this is just a short time frame, which isn't always the best way to compare. There's been an increase in 3 specific areas. So disease of the heart, malignant neoplasma, which is also cancer, and unintentional injuries. So those numbers have increased over that short time frame, but they're also much higher than they are in Indiana, in the United States. So I just wanted to kind of point those out specifically. Next slide. Yep. All right. So Erin had already talked about the interest survey and the listening sessions, but this slide specifically talks about the interest survey and what people felt were the most challenging. And obviously people could pick more than one, but diabetes, cancer, physical activity are all 80 or more out of those. How many? I think it was like 170 listening sessions that there were, or interest surveys, sorry. Next, yep. So when doing the listening session specifically, the highest number or most challenging concern noted was the cardiovascular disease, diabetes, and food insecurity. So very similar to the other one, but slightly different in some areas. So based on the challenges that were mentioned during those listening sessions, I went through and looked at themes that were commonly brought up and why they were considered challenges. And this word cloud specifically kind of shows you what topics kind of came to light. And so the bigger the word is, the more often it was talked about. So diabetes is the larger one of the ones mentioned, but also heart disease, nutrition, not physically active, were also at the top. So connection and health doesn't cover all of the areas that came up with those themes that were brought up. So kind of looking specifically at ones that connection and health focuses on, we narrowed down those to the ones listed here. And again, the larger the word, the more often it was talked about. So again, the diabetes, nutrition, heart disease, and not physically active were the larger ones. Next slide. Okay. And then obviously some of those were very similar. So physical activity included both physical, or in the word cloud previously, there was physical activity and people not being physical active. So we included those together because they were very common, but slightly different. So we included those together. And nutrition, there were different parts where the food desert, knowing how to cook healthily, too much fast food option, or not having nutrition education. So kind of putting those together to get different themes. And if you look at this word cloud, nutrition kind of stands out the largest in regards to those. This slide and the following slide, I'm not going to sit here and read those, but it has a lot of information that came up in those listening sessions on why they were considered challenging. Again, Karen mentioned earlier, these slides will be available so that you guys have all the resources and have all of that information, but you can see just some of the things that came up in regards to those challenges.
Thank you, Crystal. I think that's it, right? Yes. Okay. So just a note about what's next before we go to our community partners. We will share the very specific data, like all of these challenges that have specific comments with the groups working in those areas. So for example, the one that says that has anything to do with smoking or vaping, things like that, we're going to share with Rhonda and the Tobacco Coalition. Those that have to do with overweight, diabetes, I see overweight several times on here, healthy food choices, things like that, then we'll share that with Caitlin and the chat group, the Community Health Action Team, and so on. So we'll divide these out, and our coalition leads who work in those specific areas will be in touch to be able to share more specific data with you. So you will have these, but I don't want you to, sometimes people really want to know the details. We're going to give you more details. So don't get too concerned about not being able to read these right now, because we're going to share that information with you. All right, so next we are going to hear from our community partners, and first up is Purdue Extension, Washington County, and I believe that's Sonia.
Hello, everyone. Thanks for attending. Yes, I'm the Health and Human Science Educator here for Purdue Extension in Washington County. Many of you on this call know me. Unfortunately, there's a lot of people in our community that still aren't aware that Purdue Extension is here and what we do for the community. And I'm located nearby behind the government building. And when you get copies of the slides, I hope that you all, if you have an educational program you're interested in, that you'll contact me. So we have 4 kind of areas that we focus on as a health and human services educator, and that is food, family, money, and health. So if there's anything going on in our community around those issues, we definitely want to be involved. And you can certainly understand why we joined in with Connections in Health and doing this program to bring resources and to improve the healthy lives of Washington County members. We're happy to have them as a community partner and be a part of this program. Some of our programs that we offer, and certainly Dining with Diabetes was one that was mentioned in the presentation earlier. That's one in Washington County that a lot of people are very concerned about. That's a program that we offer. We're getting ready to do one virtually here in February. Hopefully we'll be able to do more in person. So when we do the cooking demonstrations that accompany this program, the audience can be more involved in that way as well. We also do the Strengthening Families program, which is designed to do just that, strengthening families, improving communication, discipline, all sorts of areas around the formation of a family, a healthy family. Where does your money go? We deal with issues with finance, helping people gain control of their finances. Be Heart Smart, a program designed to help you focus on your heart health and make lifestyle changes that support good heart health. PASTA is another program we're offering here in Washington County. I'm making a shameless plug for it as well, because that's parenting the second time around. We have a lot of families in Washington County where perhaps a grandparent or an aunt or uncle are having to take over the role of a parent for a relative child. So we have a wide range of programs. And here's some of the dates again that I wanted to mention that are coming up on their calendar, just so anybody wants to do any planning or reach out to us about potential audiences or future programming, please give me a call or email me. And again, I just want to share a little data about the impact that Purdue is making on the health life of people throughout Indiana. We're in all 92 counties. And so these are some numbers and data we like to share with you to show how we too are contributing to having better health.
Awesome. Thank you, Sonia, and all the work everybody at Purdue Extension is doing. And speaking of Purdue Extension, Caitlin is also with Purdue Extension, and she is going to share about the Community Health Action Team.
So the Community Health Action Team, Sonia and myself, we co-facilitate that group. And I'm a community wellness coordinator for Purdue Extension's nutrition education program. And part of my role is to work with community partners to implement policy, systems, and environmental changes around physical activity, nutrition, food security, food safety, and food resource management. And so I work with a variety of partners throughout Washington County, but one of my biggest partners is the Community Health Action Team. That was established in 2016 because we had to do some needs assessments. We used the change tool from the CDC to really guide what work we needed to do around health here in Washington County. And so from that assessment, there was a group of community members who went out and did that assessment. And then we've just stayed together since 2016 to work on increasing the health and wellness within Washington County. And so we are a group of Washington County, Indiana community members who envision a safe and healthy community for all, which promotes physical, mental, and emotional wellness. And we have community members from healthcare providers, mental health providers, insurance companies, local agencies, universities, social service organizations, fitness centers, and then we also have community members on the team. And so you can go to the next slide, Karen. Thank you. So we just work on a variety of initiatives within Washington County, and in 2022, we hope to continue the promotion of the Washington County Park Hop. That was something that Chat piloted last year, and we had 482 community members or families pick up a park hop passport at the Salem Public Library and hops around to different parks. And then we'll continue our connection and our partnership with Connections in Health to address chronic disease. And we hope that you'll join us within that work, because we need the community to really address these chronic disease issues. And so this is the first step, being here today, as well as completing those surveys and listening sessions that a lot of you did. And then we'll continue to host our annual Walktober, which is a monthly walking challenge in the month of October. And then this year we actually changed it to an activity challenge. So as long as you were out and active, you could count that time. And then we would like to research how to become a trauma-informed community and really have trauma-informed practices within all of the services that are hosted here in Washington County. And then we also are planning to offer a nutrition prescription program in partnership with Lost River Market in Orange County, and then local healthcare providers. And that will be here in Washington County. We'll do a 6-week trial program in March, and then a 20-week program starting in June through the middle of October. So these are just our goals, our happenings right now, but those will change and probably increase based on the feedback that we've received from the community. Okay, next slide, Karen. And then we would love to have you join chat. A lot of the things that we've talked about today and issues or areas of improvement, we'll be working on as the chat group. So we meet the third Thursday of every month at 2 o'clock. And right now we're doing it virtually as well as in person. We would love to have you join us. You can email myself or Sonia. Both of our emails are there. And thanks so much for being here. I think that really you being here and Connections in Health being a partner with us will really propel the work that we do in Washington County and the work that Chat does. Thanks.
Awesome. Thank you, Caitlin, and everybody that has been involved with Chat. We look forward to continuing to work with you. Okay, I'm going to turn it over to Rhonda now.
Okay, thank you for this opportunity to share this information about the Washington County Tobacco Prevention Coalition. So I just have a few slides. This is the introductory slide here, and the items that I will be covering in the next few slides are the priority areas of TPC, Indiana Tobacco Prevention and Cessation areas of selection that we focus on in our grant, and then local successes and challenges, and then just some examples of outreach for each of those priority areas at the local level. So next slide. Our Indiana Tobacco Prevention and Cessation areas include priority area 1, decrease tobacco use rates among youth and young adults. Priority area 2, increase the proportion of Hoosiers not exposed to secondhand smoke. Priority Area 3, decrease Indiana's adult smoking rate. Priority Area 4, maintain state and local infrastructure necessary to achieve health equity by eliminating tobacco addiction and exposure to commercial tobacco products. Next slide. So just an example for Area 1, youth and young adults. Every 2 years, you'll see at the bottom of the screen, we do standardized tobacco assessments in a retail setting, which is a team approach to completing retail surveys of how the tobacco products are priced and marketed at the local level. Then we receive that information in a PowerPoint format along with state data. And that information is what we call point of sale education. And the second bullet point shows that, for example, from our Indiana program dashboard, that with point of sale, 37 partners completing activities for this deliverable. This was for quarter 3 of 2021, and 12,352 adults and youth reached, and 5,412 of that was youth being reached. And in Washington County for 20 and 21, we did point of sale, STAD, meaning Students Against Destructive Decisions. Truth is called STAD, Truth in Plain Sight Partnership event, with this PowerPoint presentation by the Salem High School STAD students to the Salem 6th grade students. We also had a panelist of community speakers that were part of the presentation. And then the same information was shared to both the other 2 schools in the county, West Washington and East Washington, to their 6th grade students by coalition partners that were at that school. And those partners are listed: Gail Weiss Carter, Rosie Morehouse at West, and then Jennifer Gibson and Whitney Smith at East Washington. And our reach was approximately 550 youth and adults with a point of sale for Indicator 1. And that's just one example. Next slide, thank you. And priority area 2, increase the portion of Hoosiers not exposed to secondhand smoke. We actually ran a Breathe Easy Salem campaign that was in 2016. And this is a local ordinance campaign to protect all workers from secondhand smoke, including those in bars and clubs, as those workers were left behind in the state law of 2012. So we had a Breathe Easy Salem committee. We had overwhelming community support through supporter cards. We had 1,000 supporter cards or more of individuals and organization letters of support, and we made presentations during Salem City Council meetings that included health leaders, secondhand smoke survivors, and veteran representation. And with Breathe Easy Salem, the council member support was 2. We had a sponsor and 1 other council out of 5. So we did not have the representation and the support we needed to get the ordinance on the table, but it was a tremendous effort by our community and the coalition. Next slide. And in priority area 3, this is decrease adult smoking rates, and a large part of that is promotion of the Indiana Tobacco Quit Line. And this slide actually again comes from our dashboard report, and it discusses volume and reach in the top 10 counties. This is for quarter 4, 2020. And you can see the county listings for volume. And then you see over at the reach that Washington County was listed for tobacco users reach. And some of the other counties listed here that some of you may be familiar with or work in or are from. So next slide. And again, with the top 10 reach listing, Washington County has had good postings for several years. You can see 2017, 2018, 2019, all 4 quarters, 2020, 3 quarters, and then quarter 1 of 2021. And I think this is really going to be a challenge for us. Speaking of successes and challenge, quit line reach and individuals calling the quit line has been an example of both. Again, success, as you can see, but our smoking rate has increased and has gone up to close to 30%. We do tend to run high because, for one thing, we're a very rural area. So you see there is much work to do with promotion of the quit line and getting that word out. And we do need support with organizations referring to the quit line and encouraging providers to utilize quit line referral methods. The tobacco industry targets certain communities that's historic, and they also target geographic areas, including rural areas. And the Washington County population is 55 compared to Indiana, 181. So you can see it's a very rural county. Good news is the smoking during pregnancy rate for Washington County is 12% to Indiana, 11%. Next slide. And priority 4 is to protect and maintain the state and local infrastructure. And that just is where so many of our partners come in, not necessarily in this area, but this is just kind of the infrastructure is almost all 4 priority areas and different activities the partners do according to their area of interest. But action areas for this particular infrastructure component is just activities with the existing partners. We try to keep them simple and easy, or for example, with Breathe Easy Salem, that was quite complex. The marginalized population outreach is a big part of priority 4 now. We also have earned and paid media, and that is a lot in part with our partnership with the Washington County Health Department in terms of paid media. New partner outreach and activities are always encouraged. We educate and thank state and local policymakers in regard to our program. And then we have a program called Breathe, Healthy Steps to Living Tobacco Free, that is actually by Macmillan Health. And those partners include Hoosier Uplands Head Start, Hoosier Uplands Bright Futures for Families, Hoosier Hills PAC, Shelter to Transitional Programs, Choices Life Research Center. And partners can use any or a combination of those programs. That's good. That's okay. Next slide. So ways to get involved here. I'm sorry. We'll finish this up with this last slide. You know, youth or adult focused presentations on how tobacco products are priced and marketed to target our youth. You can become a STAR team member. It's so simple. Join the Indiana Tobacco Quit Line Preferred Network to help with those referrals to the quit line, help reduce that adult smoking rate, learn and share information on the harms of secondhand smoke. Join businesses that have established a tobacco-free campus policy. Be a Breathe Easy Salem supporter. Examples there: outreach to elected officials, brief presentations on secondhand smoke, and Breathe Healthy Steps to Living partner, or offer contact information that you may have for reaching marginalized populations. So with ways to get involved, I'll close that section, and thank you for allowing me just to review a little bit of the priority areas and local activities that we've had with Washington County Tobacco Prevention and Cessation. Thank you very much.
Awesome. Thank you so much, Rhonda, and everyone who's involved with the Tobacco Coalition and the work that you were doing in the community. Okay, next we have choices slides, and I think maybe Sonia was going to cover these.
Yeah, sorry they weren't able to have a representative here today, but Choices Life Resource Center is here local in Salem that we partner with a lot, and they also have an office in New Albany and Corydon. And as you can tell, Choices offers medical care for pregnancy, provides counseling, educational services on sexual health, free baby supplies. They have a Step Up Parenting Resource Program, and they'll talk a little bit more about that. They're nonprofit. All services are free. They're very professional. You don't need insurance or residency. If you're in need, they are here to help. They also provide services such as a pregnancy test and ultrasounds, and they can help you scheduling other exams with their facility. They have a medical office there attached to their facility that can provide limited services. And they do STI testing for women and men. Their services are free, but there may be a low cost lab fee involved. And they have great parenting resources. They have classes, some of which Purdue Extension has participated in and provided, as well as other community partners. They offer group classes and one-on-one counseling. They encourage positive parenting. If you complete a class there, they have a boutique there, and they have baby bucks where you can go in just for taking an educational class. And you can use those bucks to buy baby essentials such as clothing, formulas, diapers, car seats, and a lot more. So be sure to use this resource and let people in the community know that it's available, because it's free. They're professional and they're there to meet needs. No income requirements. Just come in and let them know what you need and they'll work with you. Thank you.
Thank you. And thanks for filling in so that we could hear about that important resource as well. Okay, so we also do not have a representative from the IU Center for Rural Engagement. Caitlin and I, and probably others on this call, have been involved with their Washington County Wellness Fair group. And they did have a wellness fair in November. And so they shared some slides with me that I wanted to share with you and invite you to get involved in the next wellness fair. There were 41 students that participated in the November Wellness Fair, and 49 residents of Washington County were screened. Some of the students and faculty staff were also screened, which is great. We were practicing what we're preaching there. They are hoping that this will help build future partnerships and opportunities, as well as increase health access to Washington County residents. There were some opportunities for people to increase their knowledge and awareness about health and well-being at the wellness fair. It does provide an opportunity for the students at IU Bloomington to actually have some hands-on experience, and also that team-based opportunity for students and faculty to plan the event. And they also developed a model for future wellness fairs. So here are some of the survey results from participants that took advantage of the wellness fair in November. 56% of the participants said it was their first wellness fair. 100% said they would attend future wellness fairs and they would recommend it to friends and colleagues. 98% liked the location and thought there were sufficient resources and that they were better equipped to understand health and well-being as a result of participating in the wellness fair. And overall, 96% rated the fair as excellent and very good. So lots of good, whoops, I went backwards somehow. Lots of really good feedback from those who participated in that. There's a little bit more information here about what went well and areas to improve. And so that's really good feedback. I know sometimes it's hard to give critical feedback, but it's really important so that the group knows how to improve the next time around. So talking about having longer hours, more advertising, transportation, the wait times were a little bit long for some of the screenings, more central location, things like that. And then the next fair is April 9th. There is a flyer for this. Cass, I believe, is going to join this group on Thursday. This is Thursday. On Monday for the other session that we have for Washington County. And so if you have not received that flyer and would like one to post or email out or include in a newsletter or on your social media, please get in touch with Kat. Her email is right there. And you are welcome to share that however you want to share it, to let people know that they can participate in this in April. And I am going to turn it over to Alia now to talk about the CADI community funding and what's next.
Hi, everyone. Alia Amin. I just want to talk a little bit about this project that Karen mentioned. So CADI, which is the Cardiovascular Disease and Diabetes Coalition, has $20,000 for a community project, community-led evidence-based project that to reduce the rates of the CADI focus areas. So I just want to tell you a little bit about the process, because we will be starting this process in February. So we hold three town hall meetings. The first one is with providers in the community. We do another one for community members, workers, anyone else that wants to give input. And then we take that data, kind of put it all together, and bring everyone back for a third meeting where we review what the community had to say and basically come up with a project. So like I said, we have $20,000, which again, the goal is not to fix a problem. We know that's not going to happen, but we want to definitely build momentum and build something sustainable. It can be a project that like we can enhance a project that's already existing in the community or start something new. So some examples of what we're doing in other communities are, I think we talked about the Purdue Extension classes. Those are evidence-based classes that do help promote a healthy blood pressure. And we are rolling out with, in collaboration with the state of Indiana, a Healthy Heart Ambassador program, Healthy Heart Ambassador, self-monitoring blood pressure program, HHA for short. So that's really to help people, again, monitor their blood pressure to prevent some of these chronic diseases. So those are just a couple examples of what other communities are doing. It's really open to whatever Washington County wants. So we are very excited. Karen, I think the flyer is on the next slide for this. So if you are interested in participating and tackling cardiovascular disease, diabetes, stroke in Washington County, then this event is for you. And we'd love to have you on the focus group. The healthcare provider town hall is on the 17th from 11:30 to 1. The community member town hall is from 5:30 to 7. If for some reason you are a provider, cannot make that time, you're welcome to attend the member town hall and vice versa. So again, we look forward to seeing you guys and hearing what you have to say and helping improve health.
Thanks, Alia, for sharing. I also wanted to note that you should have received, if you pre-registered for this, you should have received an email earlier today giving you more information about today. And also at the bottom of that was the town hall information. There's a flyer that you can click on a link to access, and you can share that with others. And there was also a link to register. So if you missed that at the bottom of the email today, go back and register for that if you're interested, and please feel free to share that flyer with others. The more people in the room, the more voices that are heard, and the more fantastic input we will get from the group. So that is the end of our slides. So do you have any questions that you would like to ask anybody that was talking today? I'm giving you a minute because sometimes it's hard to find that mute button. Go ahead and unmute if you would like to talk with us or ask anybody for clarification or a question. Okay, well, I think that we have come to the end then. I hope that you got some good information, that you learned a little bit more about what's happening in your community, or even a new group that's working to address health issues, maybe some data points and some interesting tidbits that community members shared during listening sessions. Like I said, our plan now is to share that information specifically with the groups that are meeting to address those focus challenges, those focus areas, and those challenges that our coalitions are working on. And so we will be in touch with those of you who are in leadership roles for those different areas. Thank you again so much for being here, because it shows that you care when you want to take action in your community. So thank you for that. Thanks for all the work that you're currently doing. If there's another group that you're aware of that should have presented today, we do have another chance on Monday. So if that's the case, would you please reach out to one of us and let us know, and we'll make sure that we can include them on Monday. It's at 5:30 p.m. So if you know someone who was not here today that you think should really hear this information, feel free to encourage them to join us Monday evening at 5:30. Okay, thank you, everyone. Have a fabulous rest of your Thursday. Stay warm, and I hope you have a great weekend. Thanks for joining us. Bye.
Thank you. Bye.